Welcome back to The New Health. Today I want to introduce you to Dr. Heather Gessling. She is a family practice physician in Missouri, history of being chief of staff at a hospital in Missouri, has been in practice for about 14 years. Welcome to the show, Dr. Gessling.
Hi, glad to be here.
So happy you're here. So Dr. Gessling is a family physician working in an area called direct primary care, or DPC. Could you tell our audience a little bit about direct primary care?
I would love to. Direct primary care is an amazing way for patients to receive the care that they deserve. And it's also an amazing way for physicians to get the love of medicine back in their life. They are not controlled by insurance companies or accountable care organizations. They get to practice the way they thought they would always be able to practice when they started medical school, with autonomy and independence. It's a membership-based model. It's not exactly the same as concierge or boutique. It's concierge or boutique is more of a um, uh, in increased cost per year versus direct primary care. Direct primary care is typically just a low monthly membership, anywhere from $50 to $100. It limits the size of the panel of the physician, and the physician is able to give more one-on-one, direct, quick care because the panel size typically is lower than when they're in the insurance model. The patients can typically get a same-day visit or a phone call from the physician or a telehealth call. Their questions are answered quickly. And another thing that is sort of a misconception in DPC is that if you enter into this type of practice, you won't be able to use your insurance if you have it, which is not true. Patients who have insurance can still use them for labs, although a lot of times I can get their labs cheaper than what they would pay for the copay if they submit their labs through insurance. They can use their insurance for imaging, or if they have to go to the hospital or see a specialist. It's just my service that is a cash pay sort of situation, just a monthly membership.
Wow, that's wonderful. That sounds not only liberating for the physician, but also for the patient to be able to have that access. And when you say panel, you mean number of patients that you are
That's
allowing
right.
into your practice. So when
Yeah.
you see that DPC, direct primary care, has a smaller panel of patients, what is the number? What is a comparison between an insurance-based physician? How many patients would they see versus how many you see?
In my current practice, I'm probably seeing a quarter to a third of what my panel was when I was in the insurance system. I had several thousand, and I currently have my panel at less than 1,000, and I feel very happy and comfortable with that. I feel like I can manage the patients quickly, and also it's not becoming to a point where they're not getting the care that they have signed up for. I am able to see almost any patient same day at this point.
That's incredible. So I know that the wait right now in the healthcare system for insurance based can be weeks to months, even if there's something that is urgent or emergent. They just can't get in with their doctor. So
Yeah,
you're
and
able to
yeah,
get them
that
in.
a lot of that burden happens because physicians only get paid if the patient is seen in person, which adds an incredible load to the healthcare system. The physician doesn't get compensated for their work. I mean, there are some codes that can be used if a phone call is made, but physicians don't get compensated for their work if they manage the patient outside of the system where they're seen in person. That's not the way it is in direct primary care. The physician is getting compensated regardless of whether that patient shows up in person. And if the patient needs to be in person, I bring them in. If I can manage them through a phone call or a telehealth, that's what we do. And it is a much more efficient way of being able to take care of their needs.
I really love the direct primary care model. I'm so happy that we're talking about this today. So if any of our audience has questions, I want to bring a few thoughts to mind that I'd love to discuss for clarity's sake. So when it comes to, you have a panel, it's a smaller number of patients. So you said under 1,000, where
Mhm.
before, let's say if you're seeing about 900 now, you were seeing about 4,000 per year. So is that it?
Yeah, my
In
panel was very large when I was in the insurance-based system. I actually had two different clinics, and both of them had a panel of 1,500 to 3,000. And so, and I was doing it. I was managing, and I think the patients were being taken care of well because I would never do anything less than, take care of their needs properly. However, it was a very stressful system for both me and the patient. They weren't getting as much time as they deserved. I wasn't able to give as much time as they deserved. I was required to do an incredible amount of computer work at night to document to satisfy insurance requirements, not just because of, the fact that those things need a document for their care, but mostly to satisfy insurance requirements or requirements and for the accountable care organization we were in, that mammoth organization that sort of demanded things of the physician, whether or not they were good for the patient or not. So within this system, there's an incredible amount of freedom, and just the freedom itself to be able to talk to patients is healing. Patients love it. They love being able to know that they're cared for and be able to have deep conversation that can dive in and get to the root of different diseases, and not just, oh, I only have 2 minutes, and so here's your antidepressant, which is what happens all the time in mainstream medicine, and it's been a problem for a long time.
So I love that we're talking about time that is spent with a patient. So what do you say you are spending the amount of time with each patient is compared to when you were in the medical model with insurance?
Oh my gosh, it's so much different. Every patient slot I typically do 30 minutes. Sometimes it's 20. If it is a strep throat or a urinary tract infection, maybe it's a quicker visit. But in general, I would say 5 to 6 times length of a visit than when I was in the insurance model.
Well, my guess is your patients also, when they present, know that they're going to get that quality time with you. So they may
Yeah.
even present with a little more relief as opposed to the anxiety we can see when we are presenting as a patient, where we know we have a very limited amount of time of our provider that's in front of us. We know what one question do we have that we can get answered in these 5 minutes. So they must present with more relief with, okay, Dr. Gessling's going to listen to my needs and she's going to really meet them.
Oh, yeah. Isn't that the truth? And that in and of itself builds trust. And with every visit, there's always things that we end up uncovering or bringing to the surface that I know would not have been discussed in a quick visit in my previous practice. And so I love that we get to dive deep and really do deep healing, really do foundational work at most visits.
I love that. And also, I think we want to also make clear that with direct primary care, you can still see everything. You're still a family physician. You're still addressing all of the needs of a patient that's going to their family physician. You still
That's
cover
right.
all of those bases.
Yeah, that is sort of a misconception among patients that, oh, I'm not really a regular doctor anymore. But I tell them, I'm like, no, I'm just the same doctor that I've always been. I'm family medicine trained. I take care of all needs. I take care of all ages. You can use your insurance for anything else that you want. And, they feel surprised because they think if they're not in that insurance mainstream healthcare model, then somehow they're venturing into alternative medicine, but that's not true.
Yes, I think it would be maybe a good way to explain this is you're the exact same doctor with a different behind the scenes business model. So if a
Yes.
patient didn't even know, they would just come in with still the same exact concerns. You just have a different business model that works really well for you as a physician to have more time, more quality visits for your patients, more bandwidth to be able to provide more care, more curiosity, more research even on your end for what those patients may need.
Oh, I love that. That gave me chills. That's exactly right. I mean, it's and the business model of mainstream medicine is broken. It does not lead to healing. It only leads to propagation of that business model. They don't necessarily want you well and healthy and healed because that would not be beneficial to their financial system.
Yeah, so it looks like the DPC model for providers even, it's encouraging medical providers, physicians as yourself, to encourage more healing, encourage more time with that healing mode and modality.
Yeah. Yeah, that's correct.
Now that's terrific. And you do still, and I know you said people think it may be some alternatives, and I know we'll talk about this more in the future, but you do work a little bit in that alternative space as well.
Oh, yeah,
Yeah.
absolutely. Over the last several years, I have learned that I wasn't taught how to heal when I was in medical school. I was really only taught how to diagnose and treat. And that hit me like a ton of bricks one day. And I realized that want to help people and help patients heal and reverse disease, not just throw a medicine at it that treats. I didn't have that concept before, but now I do. And I get to the root cause and I want to figure out what's happening metabolically in their body to be able to reverse their diabetes, hypertension, or quote high cholesterol, which is a topic in and of itself, but or reverse their gout or reverse or heal their arthritis. I mean, every single condition your body can basically manage. You give it the right tools and you reduce the toxic load and reduce the cellular stress load, and your body can take over and heal that.
That's amazing. So, Dr. Gessling, tell me a little bit about what you're working on and how people can reach you.
Yeah, well, if you're in the state of Missouri, my website is gesslingfamilywellness.com. I have two locations in the central Missouri area, Macon and Boonville, and I'm on Twitter at hgessling. I'm also doing a detox project with my wonderful friend Christian Elliott, who's a wellness coach, and we have started a program called Detox You, and you can find that at www.healingunited.today. And I think you have to put that www in there because the system is not used to the website and not used to the dot today. So it's www.healingunited.today. And you can sign up for our email newsletter. We're going to do our next free 2-day detox workshop in September.
Thank you so much for that. Well, thank you so much for coming and joining us this week. I'm looking forward to having you back next week. So, everyone, if you'd like to return with us next week, hear more about Dr. Gessling's work. We have some really exciting topics coming up. And please come back after these messages to join us for our next guest.